40 and ends 10 kilometers on its way to flee. That's the essence of today's distance. But we are going on the road to see the nature of the road. I know my directors want us to go back and look. Okay. We are going on the road to see the nature of the road. Okay. And what interventions to do on that road. But first of all, to establish that yes, 10 kilometers has been done. If you take it to flee, it will be like work in progress, as the journalist who was at the JFM journalist asked. It's still work in progress.
From the Hohoi-Golokwati Road, the next port of call was the main Hohoi Township. A number of the roads inspected were completed, with some at various stages of construction. However, there were several others that have been abandoned for years. One such abandoned road is a 4-kilometer stretch in the main Hohoi Township. The contractor working on the project, Guhet Construction Limited, won the contracts about 4 years ago, but has since, on the receipt of the initial payment for the commencement of work, has done very little to complete the road.
Take them to the Brother Road. Take them to the Brother Road. Keep your fools here. Your own fools here. Take them to where the problems are. Take them to where the problems are. Don't come into the foolish here. You think this? No. What are you? What do you mean? This is not the road we are talking about. There are problem zones in town. Take them there. Don't just bring them here and think you are finishing. There are problem zones in Hohoi town. There are roads in Hohoi township that you cannot drive on it. They are deceiving the people. They are deceiving the people. What do you mean? It's not our town. Let's go to the town road itself. We are natives. This is our town. They are not going anywhere. All the roads are no good. They say the road is good.
The contractor, who did not appear bothered about breaching his part of the contract, explained that he used the first payment to settle debts.
You wait. Listen. You have a contract with the government of Ghana to construct the road. You abandoned site. Why did you abandon site?
Look, let me explain to you. Somebody mentioned that I collect the money, then I abandon the contract. I didn't collect any mobilization for this contract due. So if you want to say something, I'll give you the paper. Then you see everything. I didn't collect any money from the. Where we are disabled.
Relocate the interview.
But the Roads and Highway Minister, Yunus Hussaini, said the contractor has questions to answer.
First of all, before a contract is awarded to a contractor, he must demonstrate capacity to do the work. That's why we certify contractors. If not, we would have just been giving people work. We would have asked them for more. So you need to know which class of certification he has, which class of contractor he is, to be able to give him work. Not so. That's the first requirement. And secondly, in the absence of mobilization, he needs to demonstrate a capacity to generate his first certificate for payments. So that's an explanation. Thirdly, he worked, and we paid. We don't owe him any money. He says that because we delayed in paying him, he then used the money to settle his debt. Now, if you don't work, in the words of Jimmy Cliff, if you don't work, how do you get paid? It's an ongoing contract. Now, when I quizzed him, he said he can complete the work in some number of months if he's able to receive payment of some works that he has done somewhere, which certificates are with the road fund. That's what he says, which is about 200,000. That's what he says. And that's why we're going to meet him tomorrow in Accra. But he owes me every explanation. It's a contract. And I think that from my legal background, I think he has breached the terms of the contract.
So what exactly are you going to do? Are there any critical actions that you going to take against?
Well, that's why we are inviting him to Accra tomorrow.
He, however, conceded that his outfit is partly to blame for weak supervision given contractors like Guhet working on major projects across the country.
Let's do some politics now, and this time let's head to the courts, where we are told a lawyer for Niyama Ashite, incumbent member of parliament for the Klote Kole constituency, was filed a suit praying the court to prevent Dr. Zanetta Rawlings from holding herself out as parliamentary candidate-elect for the constituency. He's alleging death threats on his life. Now, this revelation comes even as the courts adjourned hearing of the case today. Let's get more from Journalist Kwachi Afreniama, who is in court and is joining me now with a lot more. So, Afre, now, does lawyer for Nyama state where these death threats are, for instance, coming from?
Well, so the background is this, that today the court, the lawyers for Zaneto were expected to open their defense, but that could not happen because of this letter that they wrote to the court. The lawyers for Mr. Ashite themselves were not in court, led by Gary Nimako. But the copy of the letter I've received, and I'll read it to you verbatim. This is what it says, and it's signed by Gary Nimako himself, addressed to the Registrar of the High Court. Says that we act as solicitors for the plaintiff in the above-mentioned suit. We wish to humbly bring to the attention of the Honorable Court that counsel for the plaintiff has in recent times been trailed by some unknown persons when driving home after close of work. The said unknown persons immediately drove off when counsel parked at the North Legon Police Post to alert the police. A report has been lodged with the police to that effect, and continues by saying that counsel is in the process of arranging some security backup to protect himself, his family, and office staff. So clearly, he does not only feel that his life is under threat, he also mentions that the lives of his family members and staff of his office are in danger in view of this circumstance. And at the concluding part of this letter, lawyer Gary Nimako wrote to the High Court says that in view of the aforesaid, counsel prays that the matter be adjourned to 9th of March, that's a Tuesday, subject to the overriding conscience of court to enable the security arrangement to be concluded before proceeding with the suit there.
Right. Kwachi Afreniama, many thanks for that update. We will be coming back to you later on for a lot more. And that was Kwachi Afreniama giving us a lot more on that particular issue that's happening at the courts. Now we are told that indeed the lawyer for Nyama Ashite wrote to the court today suggesting that indeed he has received a lot of threats on his life. Meanwhile, we have been speaking to the NDC on this very issue, and Communications Director for the party, Deputy Communications Director for the party, I beg your pardon, Fred Agbenyo, insists the party did not err in allowing Dr. Zaneto Rawlings contest the position despite the fact that she was not a registered voter at the time. He ever admits that, he ever adds that the party is prepared to rerun the polls in the constituency should the court decide so. He's been speaking to me on News Desk.
Following this issue, especially in the media, and the understanding I'm getting is that Zaneto as of now is not a registered voter. You know, so when we're doing our vetting for the elections to be conducted, that issue really didn't come up too serious because we knew that there will be this limited registration that was done. And so therefore, before she goes to register in the electoral commission to contest, she would have obtained a voter's ID card and be a registered voter. But I think that since the issue is still in court, I don't even have to go into the details. Their own lawyers will go and argue it out. For us as a party, we have taken a decision, we have vetted our candidates. If the court says otherwise, we'll do what is needed.
So, what does your constitution actually state? I want to try and understand something. What does your constitution say are the requirements for any person who wishes to contest on the ticket of the NDC as a member of parliament?
Well, I think our constitution is very clear that one should obtain the qualifications as per the 1992 Constitution, and then also you meet the guidelines of the party, which includes that you must come from a constituency, you must be a registered member within a constituency. One should have been be a member in that constituency for a number of years. Either it was 4 years, you have reached to 2 years, and there must be a party member of good standing. Good standing means that you have a party card, you are paying your dues up to date. Then you are qualified to contest once you meet the constitutional requirements and this guidelines from the party.
So does that particular explanation you just gave to me, does that not suggest that the party has perpetrated an illegality and in fact is seeing it through this whole time?
You see, I don't know where the illegality comes in. The constitution says one should be a registered voter. Now, by the time, I made a point earlier that by the time one goes to file nomination letter.
Okay, Fred, just hold on briefly, and I'm having a copy of the Constitution. I'm trying to read something. It says, a member shall not be qualified to contest primaries for any parliamentary seat if he, A, is disqualified under national electoral laws from contesting for any parliamentary seat. And your constitution is subject to the 1992 constitution, which suggests that for anyone who wishes to contest the seat of a member of parliament, he or she must be a registered voter. So I'm trying to link the two of them, which suggests to me that you need to, at the time of filing to represent your party as a member of parliament, that you must have met these criteria.
You see, again, I said I'm not a lawyer, and two, because the issue is in court, I think that we need to be very careful how we go into this issue. Now, the point I'm making is that NDC, one, the fellow must be 21 years and above. Somebody who is qualified to be a registered voter. We were very much aware at the time we were doing the vetting that limited registration will take place. And that limited registration will precede registration with the electoral commission. So by the time we're going for, or we'll be going for national election, whoever is qualified, is 21 years and qualified for the constitution, would have registered and be holding a card, which then would have made him eligible to contest the election.
Is the party ready for a rerun should the courts decide that indeed Dr. Zaneto Rawlings did not meet the criteria at the time of contesting for this particular primary, and as such cannot be held as the NDC's parliamentary candidate for the Klote constituency? Is the party ready?
When we get to that bridge, we'll cross it. Like I said, when the court takes a decision, there's nothing we can do. After all the
You're watching News Today here on your Joy News channel, Multi TV. We're taking a break. We'll return shortly with some more. Don't go away. Thanks for staying with us here on News Today. To some more stories now. And the acting executive director of the African Development Program, Charles Othinolabi, says Ghana is in no position to cope with the many challenges in the country's health sector if the Danish government withdraws its support in the sector. Mr. Abe believes the country's health authorities have failed to put in the necessary contingencies despite being given prior notice by Danida on this planned action. His comment comes at the back of the announcement by Denmark to withdraw its support to the country's health sector. You're speaking on the AM show.
It's a reflection of failure to always look at the fine details as a country. We don't read. Because the health sector support program, Danida, kick-started as far back as 2012 with the government of Ghana. You would find in there that they had signaled this intention that they will exit their support
in 2016.
Yeah. More so because we have attained a middle income status. So really, one expects that the PPME unit of the Ministry of Health, which is the Policy Planning and Monetary Evaluation Unit, would have, noted this issue as a strategic risk or threat to our health sector financing, because indicative budgets from the health sector supports program by Danida, that over the 4-year period of their supports, they were going to invest close to $64 million in Danish kroner terms, over 440 million Danish kroner terms. So yearly amounting to an average of about $15 million, which is substantial. And more importantly, the component this support goes to was to help with the Ghana Accelerated MDG framework, and to the effect that they were supporting us towards the MDG 4 and 5.
Right. So what alternative measures has the government put in place to ensure that healthcare delivery in the country does not suffer? Let's get onto the phone lines now and speak to Chairman of the Parliamentary Select Committee on Health, Joseph Ilecho, who's joining us live now over the phone. Mr. Ilecho, good afternoon. Many thanks for your time on News Today, sir.
Good afternoon to your listeners.
Indeed. So, sir, the first thing I want to find out from you is whether or not this has been communicated to your committee, and if it has, what options is the committee looking at exploring to ensure that this does not in any way affect the country's healthcare system?
Thank you very much. No, this has not been communicated to the committee. And we are all hearing it from the news items that the minister held a meeting with them. But what I can say is that as soon as we became middle income by the computation of our economic figures, almost every donor has been trying to leave us to do our own thing. So I'm not surprised. Indeed, the Danish have supported us a lot in various ways. When I was regional minister for the Upper West region, they supported in the development of health centers, over, 30 of them in the region, and it helped greatly. I also know that almost every year they supported the health sector with a lot of money for training, for equipment, and the rest of them. So we certainly will miss them. But that also shows that we should now be developing our own capacity. Indeed, this is one of the areas that we will miss them. But as they are saying, they think we have grown and we are of age, so they want to help other people who are less fortunate than we are. It is in this regard that the committee is waiting for a full brief from the minister, and then we will look at areas that we can support the ministry to raise more resources to support the health sector.
Mr. Enicha, one thing we got from the health minister when he spoke to the media yesterday was the fact that, his ministry was considering the introduction of some new taxes to help cushion the health sector. Is this something your committee is okay with, really, seeing that already there seems to be quite a number of taxes that people seem not to be too happy about? Is the committee willing to consider the possibility of the introduction of some new taxes just so we can make some more money for the health sector?
Yes. First of all, let me say that as far as the committee is concerned, we have been arguing for additional taxes, but those taxes must be specifically for the health care of Ghanaians. And once you indicate that, many people will track and see, is this money being collected? Is it going to improve the health sector? Indeed, many times taxpayers are concerned about how their taxes are used. When we were reconsidering the National Health Insurance Law about 2 years or 3 years ago, we wanted some more levies to be added to get the big companies, the timber companies, the rest of the mining companies, who simply have uploaded their staff on the National Health Insurance scheme. And they used to run their own health scheme and mutual health scheme. So we were looking at after profit if they can pay a little bit. So there are many ways. Apart from that, it is not just the introduction of the taxes that we should be looking at. It is bringing more people into the formal sector to be able to tax them. We should rope in more people who currently earn income but are not targeted.
Are you by this suggesting that the finance minister has not done well enough in roping these people in?
No, it is not the finance minister alone. This is the whole government policy. Every year, if you look at the budget they read, they talk about how they can bring into the tax bracket those who are not paying tax. And you see, the taxable people are many, but they are not currently being captured. Indeed, it is not just a matter of increasing taxes or introducing more taxes. It is more of getting people who are currently not paying taxes. And we must all put our heads together, and we will support the ministry in any such measures that we want to introduce.
You're going to support the ministry even if it proceeds to introduce some more taxes?
No, the ministry doesn't introduce a tax. They can only make a recommendation to the Ministry of Finance. And I'm saying that any innovative ways that we can get more people to pay a little more, and those who earn a lot more money, as we try to do with the National Health Insurance Scheme, which is cross-subsidization. Those who have must pay for those who are left endowed.
Okay.
So that is the kind of thing that one is looking at. Okay. And it is, you see, taxes by themselves are not a problem, but it is how the taxes are used, how people are convinced that their taxes are properly being applied. And we have been arguing that if people know that this particular tax is for their health, what is much more than a healthy person? If you are not healthy, you cannot be wealthy. So I believe that if people are convinced, and you are not going to force it through the throats of Ghanaians, This will be debated in Parliament. Everybody would have a say, and at the end of it all, if the representatives of the people say, look, we think this is good for us, we will do so. Of course, there will be one or two people who will be against it. But as for the committee, we are prepared to cooperate with the Minister of Health to see how central government can introduce some innovative ways of funding the gap that will be left by the NHS budget.
Indeed. Many thanks for your time on News Today this afternoon. And Joseph Vieletre is the chairman of the Parliamentary Select Committee on Health. Now, the Kolebu Teaching Hospital has set up a fund to augment government's efforts in infrastructural developments at the teaching hospital. Public Relations Officer of the hospital, Mustafa Salefu, tells Joy News a special board of trustees has been constituted to ensure monies generated from the fund are put to efficient use. He's been speaking to Mamavi Uswabwaji on the AM show.
It's about the patient, and then government is doing its part. Since 2012, government has invested more than $63 million in the retooling several parts of the hospital, rehabilitating facilities. But in spite of all of that, there are still challenges. And then we've realized at the hospital that there's this goodwill towards the hospital. But then sometimes people are not certain how they will come and then assess the hospital. So the board, upon assumption of office, decided that it's important for us to set up a transparent vehicle so that we can, the philanthropists, corporate bodies can donate into that fund, and the monies will be transparently used.
Let's dwell on that.
Yes.
How do we know that when we give to the fund, it would be used for its intended purpose?
Yes. We are thinking that, yes, we have to bring in other people to come to help. So we are going to have a board of trustees made up of accomplished and distinguished Ghanaians and from various fields who come and then manage the fund, so that if the hospital itself wants resources from the fund to undertake any project, then we have to apply, you have to make a proposal to the board. That will be independent of the hospital. They only give their reports to the hospital board. But we can't get up just as a department or unit and then go straight to the fund and say, I have this project, invest money in it. So we have those structures in place to make sure that people who donate can actually come and then we account to the last CD how we've expended those money.
So if I donate,
yes,
am I given preferential treatments? Does the hospital recognize me as an individual who's done some good deed?
Yes, there are plans for doing all of that. Already some organizations is made some donations, and they have been given the opportunity. We have named wards after them for doing all of that. So all of these things are ways of recognizing those who put their money into the fund. Let's say we are talking about the children's emergency. And then when you come there, sometimes you find 2 babies on a bed. In the appropriate do it is, sometimes if you ask them to go, it means you are virtually sentencing the person to death. So how do you do that? So if, let's say, multimedia decides to come and do the children's emergency for us, we can name it Multimedia Children's Emergency Center. And that will be a lasting legacy for multimedia or whatever company that will come to do that.
So essentially you want to expand some of the facilities that you already have.
Exactly, just for the patient.
And time now for some business here on News Today with Emmanuel Abuaji.
Again, welcome to business. Keeping to time in general activities is a major factor affecting growth of the economy. That was the general verdict of participants in a national dialogue session on timekeeping among Ghanaians. There are concerns Ghanaians tend not to keep to time for various reasons, and be it personal or work-related. But speaking at the launch of the national dialogue on timekeeping, Deputy Communications Minister Ato Sapon emphasized an improved transportation system should significantly help address the issue.
We've not done the numbers yet, but I believe that if we do an analysis of how much time we spend in traffic in the morning 24-hour day, I would say that 3.5 hours, 4 hours averagely is spent in traffic. The system is really not ideal, because in the other part of the world, if the man says I'll be there at 10, he knows he can get there at 10 because at 9:15 you'll be in the bus. And if you take the bus 20 minutes to get there, or at 9:30 you'll be underground, and it will take you 20 minutes to get there. So you can promise and deliver. In this part of the world, unfortunately, it is not so. And I believe that we'll all come together, work together in resolving some of the challenges that we have, and ensure that we utilize time the way we must utilize it.
Other participants at the dialogue session added their voices to the call and impressed on individuals and institutions the need to be disciplined with time towards the country's economic development agenda.
It's a very important commodity in every country's, should I call it, development. That is why some economic indices have measured, for instance, the number of days or the number of hours it takes to register a business. The number of days or the number of time it takes to register property. These are symptoms of what they call the competitiveness of a country. So I think time is very crucial in every aspect of our lives.
If institutions are able to respect time, you go to a public institution where a service is supposed to be delivered, and it doesn't, instead of taking about 10 minutes for that to be done, and it doesn't take 1 hour for that to be done, then we expect that productivity should improve.
Now, a gallon of petrol or diesel is now a little cheaper than it used to be some 2 weeks ago. This is because prices of some petroleum products have gone down marginally. George Rafe tells us more.
The reduction, especially for petrol, has come about because of the cost of transporting the product has gone down marginally, as well as the cedi's marginal stability, which has resulted in the price going down by some 7%. However, the same cannot be said for diesel and LPG, as the price of each litre and kilogram has gone up. Players in the market are attributing it to the fact that the cost of transporting these products on the international market have gone up. Hence the decision to increase it by almost 2% at the pumps. This is the second time in 30 days that the price of petroleum products have gone down marginally. Analysts are attributing it to the slow rate at which the cedi sometimes depreciates against the dollar. However, because of the deregulation policy which allows each of the oil marketing companies to set their own prices, price quotes may still differ from one station to the other.
And that wraps up the business segment for the afternoon. Thank you very much for your attention, and join me again at 7 p.m. for more business news.
Thanks for staying here on News Today. Now, judicial service workers are threatening a strike over government's failure to pay their consolidated salaries since June 2015. The workers say government's insensitivity to their plight has left them with no choice other than resorting to the strike. Judicial President Alex Nate has been speaking to me on News Desk.
From what we deduce from the demeanor of government after the Honorable Chief Justice has submitted a proposal regarding an approved salary that enable her to run the judiciary and the judicial service efficiently, and government has since not done anything about it. We are of the view that government doesn't have the judicial service at heart. That is why government could maltreat such an important proposal.
Mr. Nate, you do agree with me that the country is facing some challenges. Could it be because of some of these challenges, government does not really have the needed funds to, heed your needs at this time?
Whenever we have an issue and we tackle it from the angle you are seeking to come from, you are telling us that we should throw our hands in the air and say that we have no help. But anything that we place premium upon is protected and preserved. And one of them should be the third arm of government. And you cannot say you have a third arm of government when workers out there are desperate and are made vulnerable because of poor conditions. They know what we want them to do. The issue is very urgent side that it ought not to have taken us the number of months it has taken us. If there was even any issue, we expected government to have come back to us early enough than the time it has taken. These are the issues we are raising.
Okay.
And the fact that workers are talking about their poor conditions does not make them, people who are irresponsible. Let me give you. We have met the labor minister more than 20 times on this issue. We have met the chief of staff, the Honorable Lady Chief Justice, in her effort to build a judiciary and judicial service that we all look for, led the Judicial Council to the office of the President, of which I was part. So if you want to know what concrete effort we have made, these are some of the efforts we have made that cannot be underrated.
So effective March 31, if your concerns are not heeded to, you are withdrawing your services or you are suspending your services.
That is what we have communicated.
And that was just President Alex Nate speaking to me earlier on News. There's time now for some entertainment here on News Today. And that's how we wrap up on News Today this afternoon. My name is Kobna Chenchen. Remember, there's a lot more news when you visit myjoyonline.com. Many thanks for your company.